we all need to care about this because, like, for us to be in the United States and to have the healthcare that we have, I mean, we're paying so much money for, like, our maternal mortality is horrific. Like, we're
Horrific. Welcome to the Sparkle Project. I'm Emily, a divorced mom of two on my own journey to shine a little brighter. This podcast is here to help you protect your sparkle amidst the chaos and impossible expectations of modern motherhood. If you're a mom ready to choose yourself and shine, you are in the right place. Let's dive in. Welcome back to the Sparkle Project. As mothers, we're up against a lot, both internally and externally. It's the things that we're up against in our personal lives and the systems that we're existing and mothering in that simply were not made to support us. And we have to keep mothering through it all. This episode is going to be both a validation of the challenges so many of us face during the season of motherhood, as well as a discussion of how we can continue to show up for our kids through it all. I'm joined today by my friend Ciara Lyons, who is a nurse, mom, and founder of Her Black Wellness. She's also a contributor to the Mom Friends Collective and someone whose work in healthcare advocacy I deeply respect. We are also having this conversation during Black Maternal Health Week, though it will be coming out a few weeks later and you'll be listening to it then. But maternal health, particularly when it comes to Black and Brown women, is something that we should be talking about always because there's a lot of work to be done in making motherhood safer. And so we will also be talking about Ciara's advocacy and educational work that supports both mothers and the systems that are supposed to keep mothers safe. So Ciara, welcome to the Sparkle Project. I know that was like a lot in there, but can you tell us a little bit about who you are and what this current season of life looks like for you?
Yeah. Actually, I feel like you did a good job.
We covered some of it. I know there's more.
I am a nurse. I've been a nurse in some capacity in different units for the last over 14 years now. Like you said, I'm a mom, and I actually had my daughter through IVF, IVF warrior, and also had her via C-section, which April is C-section Awareness Month. I actually had forgotten about this until I heard about it yesterday. I am the eldest daughter, so that means I'm bossy. Uh, I think I wear many hats, but my main focus and things are on healthcare and my child and momming in these streets where it's very hard and difficult, as we know. The season that I'm in is toddler mothering. And if you are in the same season as me, hold on. Do you need a hand? How can I help you?
Probably.
This morning alone, my child had like a 5 minute just crying because she couldn't get her shoes on. So there's that.
Yeah, it's like the problem becomes another problem.
Yeah, exactly.
On top of it all. I'm so curious in your work how motherhood like has influenced the work you do. If maternal health was something that you were passionate about prior to becoming a mom, your work has a lot to do with like racial bias in healthcare. And when we think about that, maternal health is like a big area of need in that work. But how did things change, or did they, or were you really involved in that prior to your experience of becoming a mom and going through the healthcare system in such an engaged way, right, with IVF and a C-section and all of that?
I want to say that I kind of was like born with this like very independent, very like social justice, like, heart. I've always been like, I want things to be fair, however that looks. And so I would say that has always been a thing. When I was younger, I did want to be an OBGYN, which is obstetric gynecologist, or the doctors who deliver babies. And then it changed as I went through school. And then once I got out of high school, I was like, well, I don't want to be a doctor anymore. I became a nurse. So I've always had like a social justice lens to anything that I've done in my life. But also stepping into healthcare as a nurse, I saw a lot of things that I just didn't agree with. And that just kind of like fueled me. And then, like you said, once I went into the realm of like becoming a mom, my first pregnancy actually was an ectopic pregnancy that ruptured and I had to have an emergency surgery, and I was mismanaged in that situation, which was nearly it was very much a life and death situation. And I'm thankful that I'm here today to tell the story because there were moments in that time that I wasn't sure if I was going to make it. And that was not necessarily, I mean, it was because of the situation, but also just because of how I was treated within the healthcare system at a facility that I worked at the time. Yeah, crazy. And so I think after that, and then having two more miscarriages, going through IVF, immediately going into postpartum anxiety and depression after delivering, and just seeing how like women could fall through the cracks of the postpartum care and not being seen, heard, especially if like you're not advocating for yourself. It really just fueled something in me. I was radicalized as soon as I got pregnant and she was born into this world, I was like, oh, I am fighting the powers that be until the day I die, basically.
Yeah.
Yeah.
Yeah, I mean, I can only imagine as somebody who, like, your career has been advocating for things and you're so aware of what's going on. I mean, being somewhere where you work, even, like, it's that ingrained. You're so aware and you are speaking up for yourself. And to know that there's women who don't have those skills, don't have the knowledge, don't have the connections or background or whatever it is that allows you to, like, speak confidently and like, no, something's wrong, right?
Right.
I could see how that would completely radicalize you. And then knowing that, like, yeah, there's work to be done to make the world a better place for future generations too. Like,
Yeah. Yeah, and I think it's
matters.
something that we all, and because we call out and we're calling for black and brown, but like I think people should understand that if it's working for us, it's working for everyone, right? Like so if like when we talk about like civil rights and things like that, like all
Mm-hmm.
of those things benefited everyone. And
Yeah.
so I like to like kind of bring that up to people because that, some people I think they kind of turn off when they hear like black and brown, but it's like those policies and those regulations and laws and stuff like that are gonna benefit the collective.
Yeah.
Um, because we're saying like, hey, if this is happening to us, if we're removed, you're next. Like, you know what I mean? So like we're trying to
Yeah.
fix it for everyone. So
Well, just, I like, we see statistics about
yeah.
the things that can go wrong for black
Mhm.
and brown women compared to white women. But the reality is that also white women, any woman who is pregnant and birthing a child, is at risk
Right.
for a lot of things to go wrong because, yes, it's like a high risk
Right.
situation. Like, pregnancy is not the safest thing, right? But it's the systems in place, and it's the fact that women are not listened to, and it's the fact
Right.
that, like, the research into all these things, like, it really is everyone's problem, right? Like,
Right.
that's the
Right.
reality of it. All of
Right.
these things.
Right.
So,
And that's something like I'm like screaming from the rooftops like we all need to care about this because like for us to be in the United States and to have the healthcare that we have, I mean, we're paying so much money for, like our maternal mortality is horrific. Like where
horrific.
what do you mean?
Across
Like
the board. Yeah.
those things don't even like make sense. You know what I mean? And I just I cannot see that and then not speak to it, I guess, at the end of the day. Yeah.
Absolutely.
Yeah.
Okay, I definitely want to get into this work more towards the end of the conversation, but I want to shift gears a little bit and talk to you because obviously you are somebody who is doing a lot. You have a lot on your plate, and you also are, like you said, a toddler mother. Like,
Yeah.
it's a lot. It's a lot. I'm curious just in like life and the way you show up to life as your individual self. If there's anything that stands out that's changed for you since becoming a mom, particularly around identity.
I'm gonna say like I feel, and I actually mentioned this to my own mother, probably like within after a year of her being alive and maybe being a mother. And I was just like, I feel more like myself now than I
Mm.
did before I had her. Like initially, like, going through that initial postpartum period, you're just like lost in the sauce, like you're trying to just make it to another day. And like I said, I really dealt with really bad postpartum anxiety and depression. I actually started medications for that. And if
Yeah,
if
been there.
for anyone wondering, like I would probably say like, it changed my life, saved my life probably at the end of the day, if I'm being
Yeah.
honest, because I was very much really struggling. But like I said, once I got like where we got through that first year, I was just like, I think like this is more me than I've ever been in my life. Maybe because I no longer worried about what other people, and I never really had that a lot, but like it was even less. Like,
Yeah.
like I would just be like, I'm a mother. I don't have time to worry about what other people are doing or saying because I have this little girl that I'm trying to raise to be a good human and to love herself. So I can't be over here like, downing myself or like putting other people down. Not that that was something I was doing, but just like more mindful about it, I would say.
Yeah.
So I definitely would say like I became more confident in who I am. Yeah.
Yeah, it's like your values, like what's important to you completely shifts because now what's important to you is your child and everything that you're doing, not necessarily just in terms of raising your child, but like living the life you want to live
Mm-hmm.
on behalf of your child, for your child, right? Like that's
Right.
such an important thing.
Right. Because I also want her to do that.
Yeah,
As she grows and as she becomes an adult, I want her to
totally.
be able to live the life that she sees for herself. So yeah.
So powerful, so beautiful. I have done a lot of reflection. So this podcast rebranded in January 2026. And of course, there was work before that as I kind of understood what I wanted this podcast to become. And really, my focus is on identity and self discovery as a mother. And it's been interesting asking more questions of guests over the last couple months, the last few months about identity and motherhood. And I'm like, why am I so fascinated with this? And I think a lot of it for me is that I had my first son when I was 23 and my identity was so like not grounded in anything, right? Like it was, so for me, motherhood, like it rocked my world. It was like crazy destabilizing, all these things. And definitely there was a before and an after.
Mhm.
But the identity piece and like what changed for me identity wise once becoming a mom, like I'm just so curious hearing from other moms who had different experiences than me, how that was for them. And I love that idea of like, for you, it actually was almost not necessarily permission to be more of yourself, but like just a reason to go further into that. Like it gives you the
Yeah.
purpose to stand on behind,
Yeah.
like, I'm showing up unapologetically because this is what matters now. And that's what I want to model.
Right. Like I felt like it was okay to let old Ciara go. Like,
Yeah.
and maybe also because I was going through like all of the emotional and mental health things that
Yeah.
I was like, I have to let go in order to be able to be okay. Like I
Yeah.
have to fully step into this new life because if I'm thinking about the past and what might change and all of this stuff, and it was just making my anxiety worse, made my depression worse. And I couldn't. I had to like be like, okay, this is where we are, and this is how we have to now move, and it's okay for that. And then I also just think that it can also be like, the experiences you've had in your life before you've had your child, the age that you are when you had the child. Like you said, you're 23, so you didn't feel like you were fully grounded in who you
Mm-hmm.
were or who you were trying to become, right? Same thing. I think about it when I was that age, and that because I have like my cousins now and all of those, and I think like I didn't really fully know what I was doing at that age. I was just living. And I had a friend, we were roommates and same age, and I think we turned like 27, 28, and we both were like, well, if we got pregnant now, we probably could do it. We probably could
Probably.
be a mother now. We would say that to each other. Before so, like, I don't know, but I think we're there. I think we've made it there. So, and then I think about my mom who had me when she was just about to turn 20. Like we just had
Yeah.
totally different lives because I didn't have my daughter until I was 35, almost 36.
Okay.
And so maybe that also played a big part of me just being like, well, this is who I am now. So like, I think
Yeah.
we all have like these different experiences, but I don't think any of them are wrong. But
No,
I feel like
totally.
society makes them wrong in a way.
Absolutely. Yeah. No. That's like, I think why, like, even me saying it right now, I'm like, it's a conversation that I don't hear people having
Yeah.
about how we respond to motherhood differently with our different factors that we're, I don't even want to say up against, because that's not even really what it is. It's almost like the background that you come to motherhood with. And of course, like you've mentioned, like there's also all kinds of mental health things that can happen with motherhood for a plethora of reasons, whether it's
Right.
like hormonal or just the fact that like we become mothers into a world that is
Hates
in no
mothers.
way meant, yeah, it's not meant to support us. Like
Right.
we are set up to fail,
Yeah.
and that can be really destabilizing and like can cause some severe stuff.
It really can be, especially if we don't have anybody or a group or village around us, like a community, just to say like you're not crazy or you're not failing or whatever it is that we're feeling. Like other people, especially women, like I said, we both Mom Collective, and one of the things that I mentioned in our last post was that being pregnant, being a mom made me appreciate the women in my life more and
Yeah.
realize how much more that I needed them to help me navigate being a mother, being a woman, just being basically in this
Yeah.
world. So, yeah.
Tell me more about that. In what ways, like, what kind of support? What is it, like the physical support of showing up for you? Is it the guidance? Is it the emotional support? Is it all of the above?
I would say it's all of the above. I mean, so my parents were together, but we pretty much grew up with my mom's side of the family. We were
Okay.
closest to them. And my mom has four sisters. So very much female dominated. We were in charge. The women were in charge. The women made the rules, like the regulations, the discipline, all of the above, right? And so that's what I grew up in. And they all helped my mom like raise us basically because we are older than her sister's kids. And so even when my aunts had kids, I was old enough to help them raise their kids. And so I would say like the fact that they show up, my aunt even helps to take care of my daughter a lot. So just physically being there to show up,
Yeah.
yes, but also because sometimes people can physically be there, but mentally they're just like ruining your
Yeah.
life,
Yeah.
because they're negative or whatever the situation is. But they also poured into me. So, like when I was uncertain or when I was like crying or anything like that, it was very much like everything's going to be okay. You're not alone. So I would say, like, also that too. And then just growing up, seeing that, like, that people can show up for you now, finding them, that might be a different story, but in my situation, that people can and will show up for you because that's just what they want to do, because they want to
Yeah.
support you, not necessarily because like it's a transaction. So I would say all of the above. Yeah.
That's beautiful. Like, what an incredible model of what the village
Yeah.
can look like, right? Like, that's something that so many women don't necessarily have. So many families just don't function
Yeah.
like that. And yet, like you said, like, that's it's not like just because you don't have that, you can't have elements of that, of people showing up for you. But that's incredible. That is so powerful and such a cool thing. And how cool that you're now raising a daughter, like,
Right. Right.
within
I
that
love that for us.
world.
I love that for me and her.
Yes, I know. As a mom of two boys who I have two sisters, I'm like, what the heck am I doing?
Yeah.
I don't know,
Yeah.
but I show up every day.
Right, exactly. That's all that matters, right? You show up every day, and
Show up every day.
you show up every day and try to do your best. And I think
Yeah.
that's what we need to be preaching to folks.
Yeah.
Like, hopefully we're learning and we're growing as we go along, day by day, year by year. That has to
Yeah.
happen to me to just be a human, but also realizing that it's not perfect at all. And that is okay. Like, we're not supposed to be perfect. And
Yep.
if we're like struggling one day and like our kid had too much screen time or
Yep.
whatever the things that like we hear from social media or other parents, like, oh, your kid shouldn't be doing that. Like, no one's going to die.
Mhm.
Also, like, if you're a millennial or anything like that, we probably have way too much screen time.
I say
Yet,
that all the time.
yet we're here. We have
Yeah.
great jobs. Like,
Yeah.
we're raising families. Like, we're tuned into the zeitgeist. Like, we're tuned into what's going on around us. Like, so, it wasn't perfect, but like, we're not out here like, just going around trying to ruin other people's lives, I should say. But
Yeah. No,
yeah,
we're doing a pretty decent job with the world we've been handed, I'd say.
right.
We
Exactly.
might be like addicted to scrolling our phones, but you know, it is the world we live in. Yeah, that's funny, that thought of like the TV was always on in our house. Like whether we were watching it or not, it was always on.
Right.
And there's so much pressure these days to like monitor and make sure everything's perfect. And obviously, like there's validity to
Right.
conversations, like not to diminish what those conversations are for, but just the like catastrophizing the impacts of like us not paying so much attention completely to how much screen times our kids are getting or whatever other number of things. It's like our moms didn't have to think about this. No one was shoving it down their throats that
No,
they needed to be aware
no,
of this. So
no.
that is
I
definitely
know that for a
something.
fact because I
Yes.
have I have told my mom things like, oh, they say like you're not supposed to do that now and stuff like that. She was like, what? And I'm like, exactly.
Exactly.
This is what the internet is saying.
Exactly. We turned out okay.
Exactly.
Ugh.
Exactly. Exactly. So, it is what it is at the end of the day. That's my favorite thing to say. You can ask my husband.
Yeah.
I'm like, it is what it is. We just gotta do our best at the end of
We
the day.
just got to do our best. And that looks different depending
Help
on what's
the
going
person.
on that day. Yeah.
Right.
Yeah.
The person, the environment, the situation.
Yeah. You've talked about this idea of continuing to mother while fighting battles. What does that mean to you personally?
I would say that it means like you're fighting your own battles. Like if it we're talking like inside of ourselves, just because we become mothers, parents, or any relationship that we're in, but specifically mothering, like it doesn't mean that we no longer have our own things going on, like our own internal things, our own emotions, the fact that we're tired or we don't have the capacity to hear someone say mom or call our name like one more time in that day. Like, you know what I mean? We are constantly regulating ourselves. And I don't think we even recognize that as moms. We all day, because we're doing for others, but all day we are constantly regulating ourselves so we can show up. And I think that we just kind of forget that and don't realize that we're doing that. Our body is doing that for us. But yeah, we are fighting a battle all the time, every day. And if our mental health is even like more heightened at that time, it's happening. Like we are fighting that. But again, we try to show up for everyone. We try to do the things that are responsibilities and things like that. And we try to do it with grace, like without snapping or things like that. Or if we do snap, then we're fighting that because we're like, oh, I snapped and I yelled and now
Yeah.
I'm a bad person and all, and stuff like that. When in all honesty, it's like, no, like you just retired and now here we are. That doesn't mean like obviously, just start taking all your issues out on the people around you, but like giving ourselves grace that we are also human and we also have a lot of emotions that we are dealing with, even if we don't recognize it like in real time. And that's okay. Like, we're not robots, but people want us to be, but we're not.
Yeah.
So that's to me what fighting battles are because I'll just be with, the last few weeks I've been tired and I'm just like laying in the bed, like, just shh, don't want to talk to me. Like, you know what I mean? But, and then I'm like, okay, now I have to get up, let me do the things, so on and so forth. So I just think that it's just a part of being a mom. being a human. Yeah.
Yeah. There's something you said in there that I'm like, that's so true. Just the piece of we acknowledge when we are not regulated, when we snap, when we have the
Mhm.
moment that we come out and we're like just feeling out of control for a moment or longer than a moment.
Yeah.
But we are regulating the rest of the time. We're not recognizing that. I think that's such an important thing to acknowledge. Like, if we only acknowledge when we're not, those moments
Mhm.
that we're not, right? It's like, even if it happens multiple times over a day and you're having a really rough day and like things are totally out of whack, the in between parts where
Yeah.
you kind of have gotten it together and you are getting through the day, you are fighting that battle internally and still showing up for your kid somewhat regulated. I mean, if that looks like, I know I've been having like anxiety recently and like trying
Mhm.
to figure out why, and it's been affecting my sleep. And so I've been so tired. This past weekend, I literally had my kids like get up and watch TV, and I stayed in bed. They ended up coming back down and watching TV in my bed. I
Mhm.
stayed in bed till 11 because that's what I needed, and they were stoked on it. They were doing their own thing and
Right.
what they needed to do. It was good. I don't know that I could pull it off every morning, but like
Yeah.
that's what I needed in that moment. That's what I needed to like be able to show up to our
Mhm.
Saturday with some amount of regulation. Because if I was like working on, I mean, I didn't go to sleep till like 4 in the morning, right? Like I would have been, it wouldn't have been great. And so I
Right.
think that's such an important note too of like whatever it looks like for you to show up the way that you want to show up and need to show up. Obviously, not always, we can't always lay in bed till 11 o'clock in the morning.
Right.
Like, we have lives to live, jobs to
Right.
do. But whatever we can do, whatever those little things are,
Right.
matter.
When you need it, you need it. Like
You need it, you need it.
I another thing since I've been a mother is that I am like, I can't do it.
Yeah.
I'm tired. I don't have the capacity. Whatever it is, like it has nothing to do with other people. It has all to do with the capacity I have. Like
Yeah.
because I know like what all I'm responsible for day in and day out, that I'm easily like, no, I won't be there. I'm sorry. Like, no offense. And I try to tell people like it has nothing to do with you or how I feel about
Yeah.
you. It literally only has to do with the fact that I like literally can't. And that's okay.
Yeah. You become more selective of like where
Right.
you're giving your energy, even if there's things that you really would like to give your energy to.
Yeah.
You also, more so than before becoming a mom, you can't get to zero. You can't drain yourself. And when you're working and you're pouring efforts into advocacy work and you are showing up for your child and you're showing up for your family and all of
Yeah.
these things, it's like sometimes there's going to be things that you might really want to do.
Mm-hmm. Right.
Also, you need to sleep.
Right. Well, they say you can't pour from an empty cup. Like you also have to relax. Even if you're just sitting around watching TV, like letting your mind just wander and like not always being on. And I have to like remind myself because I will get like it just where I'm just like going and then I'll be like, I'm so tired. And why? And all that stuff like that. And then finally I'll be like, I'm just gonna like take a nap. Then I'll like share with my sister and my mom, and they'll be like, yeah, like you're doing all of these things. Of course you're tired. But in my mind, I'm just like, I'm just going and I don't recognize it. So,
Hmm.
and that happens to a lot of us. And it's okay.
Yeah.
Sit down.
Yeah. It's okay like to like recalibrate. It's okay to like do quote too much and then recognize, okay, gotta
Yeah.
rein it in. It's like a
Gotta rein it
constant
in.
figuring out what's gonna work for you because it's also, I mean, I think just of the factor of like our kids are always growing and changing
Mm-hmm.
rapidly when they're little, right? Like it's
Mm-hmm.
the energy we have to pour into that relationship
Right.
changes very frequently. And so then we have our own things. We have the like what's going on in the world things. We have all these different things that affect our capacity, our health, our mental health,
Yeah.
the people in our lives' health and mental health. Like there's so many
Right.
factors. So knowing that like, yeah, sometimes you're gonna maybe overdo it because it worked and then all of a sudden it doesn't work anymore because either things have changed or you just the lack of sleep has taken
Right.
its toll. Yeah.
Balance. If there is such a
Balance.
thing,
Yeah. Whatever
we
that means
try.
to you.
Right. We try,
Yeah.
however that looks. And yeah, and sometimes that looks for me as like going hard, working a lot, doing things, and then I'll fall off the face of the earth and you won't like hear or see me for weeks at a time. And then I resurface. I'm like, okay, I've had time to, regroup. I'm back. So yeah.
I'm laughing because so the Mom Friends Collective, if you're not following the Mom Friends Collective yet, go follow us on Instagram. But
Yes.
we have a post about mom friend types, and you lovingly referred to yourself as the ghost friend.
Yeah. Because I am.
Yeah.
Ask my
Disappear.
friends.
Then
I
you come back and
disappear.
you're in it. You're there for
Right.
them when they need you.
Yes, yes, exactly. I will, like I said, fall off the face of the earth. You can ask them, like, they won't hear from me for weeks. Or, I mean, like, there'll be stuff like maybe I send them like memes on Instagram or something like that. But, like, we're not like, I don't see them. We may not talk on the phone, things like that. And to
Yeah,
me, that's like normal because we all have busy, crazy schedules and things like
totally.
that. So we don't really have time to like at least for me. I'm not saying that it's wrong or right, but I don't have time to like talk all the time, see all the time, things like that. So, and that's also how I like regain my energy in general. I'm a loner in that way. Like, I need to be alone, I need to be at home, and then I can pop out and be like, okay, I'm here and I'm ready.
I
What
love
do you
that.
need me to
Well,
fight?
I'm ready to go.
Yeah.
Well, from the comments on that post, I think a lot of people can absolutely relate. I mean, how could you not? Like, I feel like that's such a, not everybody needs those periods of like isolation, but when everything is so demanding, I mean, your job has to be like you're on caring for people. Like that in itself is such a energy suck, and not in a bad
Mhm.
way, but it's like it's very much
Right.
like you're pouring a lot from your cup. And so
Yeah.
it makes sense then, showing up for your family, all of these things. It makes sense that, yeah, there's going to have to be like these little seasons of recharging
Hmm.
and refilling the cup because you can't just keep pouring till you're empty.
Right. And I used to feel bad about that actually, because, people were like, oh,
Yeah.
we haven't seen Ciara or anything like that and stuff. Until I started kind of like looking up and looking into it and just kind of like seeing like what type of characteristics that empaths have and like
Mm.
also your like human design and stuff. Cause I always said like I am like a pretty neutral. Like my energy is pretty neutral in most situations. Like you have to really push me to be upset. I'm just usually like right here. But I can feel everyone's energy. It's like I'm absorbing it
Mm-hmm.
and then, but I'm like the calm in their storm. And so in my human design, it actually spoke to that and I forgot what like the number is or whatever it's called, but it says that I am someone who like I reflect the emotions back to you. My energy, it lets people think that I have no feelings, like I am like
Mm.
void of feelings, but in reality I just take on the energy and feelings of the people around me
Yeah.
and kind of like reflect it back to them. So like it says like sometimes when people think like you're annoyed or upset, it's not so much that I actually feel those things. It's because that is what that other person has shown me,
Yeah.
basically. And so I'm like reflecting it back to them. And so
Yeah.
I was like, oh wow, like, okay. I don't know. I was just like, yeah, in my nursing role, I'm like, hey, how's it going? I'll have people like just dump all of their
Totally.
problems immediately. Like I'm
Yeah.
like, we just met. But but I guess and then they'll say like it's like they come out of a trance and they'll just be like, well, I don't know why I just told you all of that. And I'm just like, cool, cool, cool. Okay. Well, um, let's see how we can fix some of these things. Like, you know what I
Yeah.
mean? But yeah, maybe that's also why I'm like an advocate, right? Like
Totally. Yeah, like the parts of you that you bring, whether it's something you're doing or it's just like the energy you give off when you meet somebody and they feel open to share with you in, I mean, a lot of people in healthcare settings, it's like a very vulnerable
mhm.
place to be. And so yeah, to be the person that's being dumped on, there has to be something with the energy you bring to those interactions, people know that you like can absorb or like can take the
Right.
energy.
And then people
It
be like,
is,
how do you do it? I'm like, I compartmentalize. I'm really
yeah,
good at it,
you
I
have
think.
to.
Yeah.
Yeah. So, thinking about like the battles we're facing, and there's so many internal things, so many factors, as we've talked about, there's also the systems that we've
Mhm.
referred to that we are mothering in. And it's also important to acknowledge that these systems impact different mothers differently, right? Like
Mhm.
my experience as a white woman is different than your experience as a black woman.
Yeah.
And we all have different experiences based on where we are, the specific institutions we're working with, whether that's in healthcare, whether that's, I mean, in any other
Mhm.
realm of existence in our society. But the reality is, like, we're living in a patriarchal society and we're raising children in this society and trying to show up as individuals and employees and business owners in this society. How do you see all of that impacting the mothering experience?
I feel like I have more like rage against
Yeah.
like what's going on around us. Also, just much more protective of my child, much more protective of myself and my family. I see like eyes wide open, of course, of like the systems, the fact that we don't have paid family leave. Some women are going back to work like a couple weeks after giving birth, which is insane to me because I'm just like, how? Like your body is not even close to being back to normal. Like this whole experience happened to you and you already have to be back at work. Like that is insane to me. And that only happens in a patriarchal, capitalistic society because there's no way, like it's not even logical the way some of the
No.
things that are set up. It's set up for men. Like it's set up for someone who does not give birth, who does not mother. And it just makes me want to fight even more because I'm just like, what this like makes zero sense. And my coworkers probably get tired of me because I always we joke because I'm like, oh, I'm on my soapbox again because I'm like things will happen and I'm just like, you know why this is happening and why what we can do to change it. Like I will go off on tangents because I get like frustrated and I'm just like this makes zero sense. But yeah, like I said, maternal mortality rate, all of that. And it's not necessarily that people are unhealthy. The system is
Yeah.
unhealthy.
Yeah.
Society is unhealthy. The fact that we're everything is for profit is what's unhealthy. Why is healthcare for profit? People are going to get sick for the rest of their lives. That's just life and death. Like that is the human experience, right? People are going to have children. That is what is supposed to happen. That is the human experience. That's how we keep our population. Like, these are things that
Yeah.
are just supposed to happen.
Biological
And
norms.
right, why is it for profit?
Yeah.
Because when it's
Yeah.
for profit, then we're only worried about that. We're not worried about the human being who is at the hands, like who is experiencing the situation. Why are we worried about if we're getting paid for these things when we're just supposed to be taking care of these people? I now work as a nurse case manager. And so I see more about like how insurance companies will and won't pay for certain things. Where before, when I was at the bedside, when people start talking about insurance, I'd be like, girl, I don't know. Like, you know what I mean? Like, I want to take care of you. I don't know
Yeah.
how they're getting paid. I don't really care. Like, this is what we're doing
Yeah.
right now. But like now that I see on this other side, and more so that I'm just contacting them, like, we need these services, so on and so forth. And they'll be like, well, we're denying this or denying that. And I'm just like, for what? You know what I mean?
It's
And I just, yeah, they all have to change. We will not, and I hope this doesn't sound like Debbie Downer, but things will not get better until these systems are changed.
yeah.
That's it. That's it. Laws have to be changed, regulations have to be changed, policies have to be changed, and that is the only thing that's going to fix this. People
Yeah.
have to be made to do better for us to see something better, unfortunately. when
Yeah.
money rules everything around us, that's the only thing. We see it. We've been shown that time and time again, right?
Yes, we have. We
So
absolutely have. And that leads me into a question that I'm like, I don't know how you're going to answer this because I want to ask you because you are so
sure.
dedicated to the advocacy work and you do a lot of like internal systems education and work within the systems, which is
Mhm.
so admirable. As you're saying, like that's really where the change has to happen. And you're like equipped and willing to like fight it from the inside, which just thank you on behalf of all of us because it's so
Yeah.
important. As individuals who care,
Mhm.
what do we do? What do we keep in mind? Because there's like, what are the things we can do as an individual to fight for those changes, to make those changes? Because it, like you said, like it has to change or nothing's going to change.
Yeah. Well, one I would like to say is that obviously it's not only on the individual of us, right?
Yeah.
Because sometimes I feel like even for myself, like I will get overwhelmed because I'm just like, I have to do this, this, and this to fight, to
Yeah.
fight. And then again, it makes you overwhelmed and then you're just like paralyzed. But it takes all of us, not just one of us, right? So just doing one thing can, start a ripple effect. But I would say like giving a voice to the voiceless,
Hmm.
speaking up about stories that you hear, especially for, I want to say for white people, speaking with other white people, like just being like, because either maybe they haven't heard the story because they're just not dialed in or whatever other things. I don't know what's
Yeah.
happening, but
It's not
um,
being absorbed or whatever.
right, because it's not an experience that is had.
Yeah.
But I think speaking up about it and talking amongst yourselves can be very beneficial to see, like, hey, this is going on. And it's not just them. Like, it's not like I heard about this and I've looked it up or whatever it is that brings you to the knowledge. So there's that. And again, across the board, like we all need to just be amplifying the voices, talking about it. When it's time to vote, we need to be present, even like locally, because a lot of the
Yeah.
things, like in California alone, let's say that it's like, well, what rules and policies are they coming up with around like healthcare? What are they doing around insurance? Like recently, I saw something about them possibly trying to get rid of patient ratios. California, one of the reasons people like to come to California to
Yeah.
work is because we have patient ratios. So, meaning that there's other states that don't have patient ratios, and we
Like,
wonder, right? Exactly. And we wonder why there's so many bad outcomes. But and immediately, like a lot of the nurses, immediately they're like, we have to fight this because one, it's
yeah.
unsafe for the patient and it's unsafe for the care providers to
Yeah. You
try
can't
to
do
care
your
for these
job.
people. Correct. And then people fall through the cracks. And then it's
Yeah.
like, well, why is this happening? Well, money, right? At the end of the
Yeah.
day. So being really focused, being dialed into, what civil rights, what laws are they're trying to place and, just things like that. And then also just like when you go into your providers, speak up for yourselves. If it's something that they're not listening to you, even if it's not around maternal health, I'm not currently working in the maternal health population as a case manager. I'm actually within the whole general population. And there's quite a few things where I see where patients are not getting enough pain medication that they really should have, or like we should get more imaging done, but it
Yeah.
hasn't been done, or like there's so many things that are happening. Some of it is because, again, insurance, they're like, oh, it's not going to be covered, or we don't have the right diagnosis. Like, why would we do it? Even though it probably could be helpful. So just kind of like whenever it's something that you feel like it's very important or you have questions, question the system,
Hmm.
question that provider. Like until you get some sort of answer, it is okay. Like I'm not saying to be mean or disrespectful or rude, anything like that. I'm just saying like it is okay to question something that you either don't understand or you feel like there could be a different answer. And we have to start doing that. We have to
Yeah.
say like, hey, Like, sure, like I get that this is your knowledge, this is what you do for a living, but also I would like to have a second opinion, or can we just look into this and document it and stay on their necks? Unfortunately, that's where we are. And from your doctors to your nurses, it has to happen
Yeah.
again because
And to your insurance companies. I mean, I've
and to
had
your
to,
insurance company.
it's
Correct.
absurd, it's ridiculous, it's so much work for people, particularly when you are dealing with something, right? Like
Mm-hmm.
a lot of times these things are like you're dealing with symptoms or you're dealing with some mental health thing or you're dealing with something
Yeah.
that is adding stress to your life. And it's super unfortunate that it's on us to take a stand. But I think that is like, I'm happy you brought that up because it's like, yeah, how do we change the system? How do we look at it like from this big view that like feels like trying to eat the whole elephant at once that we
Yeah.
can't do, right? But knowing that like simply increasing your confidence and being able to stand up and advocate for yourself in a situation that maybe before you wouldn't have, because the situations will arise. I mean, like I can think of multiple healthcare scenarios I've been in where like some in the past where I'm
Mm-hmm.
like that never got dealt with. Like there's
Yeah.
something that like what was it? It never got dealt with. You
Mm-hmm.
know?
Mm-hmm.
Um, we all have the opportunity to advocate for ourselves in the healthcare setting, unfortunately, right? Like it's
Yeah.
not fortunate that we
Yeah.
have to, but I think that's a really empowering place to start. And I just so appreciate all of the pieces you've given there and the validation of the overwhelm of
Yeah.
like, we're talking about like systemic change that these systems are based in a deep rooted patriarchal capitalistic society. Like it's literally it's not just going to change overnight. But
Yeah.
I know that's something we're both in California,
Yeah.
and I'm not going to speak to it right now, like fully, because I don't know. But like the governor race, I'm like, what's the
Yeah.
word, the weird word they use for what that race is?
Gubernatorial or something like that.
Gubernatorial, yeah,
Yeah.
something like that. I've seen it written down. I know healthcare is becoming a bigger topic in that race right now. And so I'm interested to see again. I need to do my research. It's very much like that piece of it's just coming to my attention. But
Yeah.
it's an important piece of our system that we're living within. And it's something that we really, it impacts other areas of our living, what's
Yeah.
going on in healthcare. It's like kind of the core of what's needed when we live in
Right.
a developed country that has access to incredible providers, incredible treatments, world-class facilities.
But we can't afford it.
There's something up here that
Right.
people are
Like,
dying of things
right.
that they should not be dying of. People are having poor health outcomes from things that they should absolutely not be having poor health outcomes from. So,
And I hate to, I don't want to say that like the system doesn't work. It works the way
yeah.
it was designed to work.
The
Right.
yeah.
So
Yeah.
I want to be clear on that. It's not that it doesn't work. It works for who it was designed
Yeah.
for, meaning
Yeah.
big corporations, rich, white, male. So it's working for the people it was designed to work
Yep.
for the
There are a
most
lot of
part.
people getting rich on the back of it right now, and
Correct.
they're probably stoked
Exactly.
on it.
Exactly. That's why
Yeah.
they fight so hard against like universal health care. They fight so hard and they put so much money forth to keep the status quo because it has worked for them. And that's why I'm saying like you don't have to like submerge yourself into all of it, but don't hide from what is happening. Feel free to open your eyes to just see it. It hurts and it's hard, but that's the only way that you're going to wake up. And that's the only way that we're going to be able to make some change. It's the only way. I don't
Absolutely.
know how else to say that or mention that, but yeah, I we can do it. We have shown time and time again that we as the people who want change, even if you're going back to the civil rights movement and all the things that came from just the civil rights laws that were enacted, like it can be done, but we have to apply the pressure.
Yeah.
And it's gonna take the mama.
It's gonna take the moms.
Yeah,
We're a force.
we're a force. I'm telling you, I was radicalized when I became a mom. I was like, oh, who
Yeah.
knew?
Yeah. Ugh.
Who knew?
Okay. The way that I love to end this conversation is with a personal question about your sparkle. This is like the essence of who you are and your energy and how you show up to life. And I am curious, with all of the things on your plate, how do you protect your sparkle?
Drinking coffee.
Love it.
I love coffee.
Cheers to
Probably
that.
more than I should. I know I'm like my little coffee over here. So drinking my coffee. I don't know if it's just because like maybe I'm perimenopausal, I'm still postpartum. I don't know, but like I tend to wake up in the middle of the night sometimes, or like the wee hours of the morning. But I love it because I'm alone and I just will like sit in the dark and just give myself some time to like think and just be quiet and be with myself. And then I also love to listen to music and just a wide spectrum of music and, sleep when I can. Lay around, watch a little TV. I'm telling you, I disappear. When I come back, I'm back to Ciara. So that is it's very simple.
Yeah.
Outside of like, getting my nails done, getting my hair done, stuff like that. I'd love to do that kind of stuff. But like literally just having some time to myself to just think or not even think, just sit there and be. That's how I keep my sparkle.
I love it. I love that that's such a like waking up in the middle of the night could really suck. Like it's not ideal, right? But to like take that and be like, you know what? No, that's actually something that has been helping me stay me. Like that's a great little
it's annoying.
mindset thing.
Very much. Like when I first wake up, I'm like, this is the worst. But then if I can't go back to sleep, I'm like, fine.
Lean in.
I lean in. And then eventually, like, I get tired again. So hopefully I don't have to go to work or whatever. But yeah.
Well, how can listeners find you? How can they get connected with the incredible work you're doing? Everyone should be following you. That's a should right there.
Follow me. So you can find me on Instagram at Her Black Wellness. All just one word, Her Black Wellness. And I'm pretty much there a lot. I'm on Threads, same handle. And then in both of those places, I have links in the profile, and you can click those to see the podcasts I've been on and just other things that I'm doing. I'm also on Substack as They Weren't Listening. That's my Substack name. And I talk about healthcare, motherhood, maternal health. So yeah, find me in those places.
And thinking about like how even following you and reading the things that you post on Substack, how that alone is such a powerful act just to equip ourselves with the reality of like the front lines of it all. You're doing important work. Again, thank you. On behalf of all of us, thank you for fighting for some really important things.
And if anyone needs like encouragement to tell your story and or fight or whatever it is, come through. I'd love to chat. I love to talk about all the things. So yeah, come through.
You are incredible. I am so grateful to be in your orbit, and I so appreciate you coming here and sharing all of this with us. Like, what an important, powerful, beautiful, empowering, validating conversation. Thank you.
Thank you, Emily. Appreciate you.
And thank you for tuning in. Keep on shining. Thanks for tuning in to another episode of The Sparkle Project. Loved what you heard? Share this episode with a friend, and don't forget to leave a rating and review to show your support for the show. We'll be back next week with another episode. See you then.